Hi guys, welcome. This is Pinnacle Healthcare Staffing, and this is our first podcast. My name is Anaya, and I'm an intern for social media marketing here. Today, it's just basically getting to know a nurse, and we have a special guest. Her name is Sheena, and we're gonna talk about like her experience growing up, all that.
Awesome. Thank you for having
Yeah, no
me.
problem. We talk about like what do you do? Yeah, like what's your occupation? What do you do for a living?
So I have been a nurse for 12 years. I started out being a telemetry med surge nurse. Since then, I have remained in that kind of scope, but I've done travel nursing, I've done regular bedside, I've done contract nursing. So it's been fun. I've mostly been in the Philadelphia area or like the outer suburbs of Philadelphia.
Okay, nice. What made you want to become a nurse?
So funny thing is, so first my mom growing up was a telemetry technician. For people that don't know, that's like the person that reads the heart monitors growing up. So that was always really interesting to me because she would come home with these telemetry strips and I'd be like, what is this scribble on this paper? Like, what is this? So that was my first kind of like window into healthcare. But then also, I'm the youngest of 6 kids, and my sisters are much older than me. So they were at their childbearing ages when I was like 7. They were already married and having kids. So I used to spend weekends at their house, and I used to always like see the babies like growing in their belly. And I would be like, how in the world can the human body like make another human? But if I like cut off my hand today, my hand can't grow back.
Right.
Like I just was so intrigued by that as a kid. And I know that's a weird concept for a kid to like think up, but as a kid, I just was obsessed with like, how does the human body do the things that it does? So that's kind of what made me want to venture into it. But I started off wanting to be an obstetrician. So I wanted to be a doctor to deliver babies. And then once I saw my first baby being born when I was like 2021, I was like, yeah, no. Because I realized that the nurses are more at the bedside. The nurses, just have a little bit more of a hands-on kind of care with the patients versus the doctor. So I was like, let me switch over.
All right. So, noticing how you're doing so well
Mm-hmm.
on Instagram, especially like you have a big platform.
Mm-hmm.
Like I feel like a lot of people know you in Philly.
Oh,
Now, I
yeah?
wanted to ask like how did you become an influencer? And I know it just comes out of nowhere, like following because you could post something that's trendy and then people are like, oh my god,
Yeah.
but how did that happen?
So for me, it was very much so a surprise. I did not intentionally go viral. I had like a little page and I would just kind of post things that were relatable to me and like post funny things. So then during COVID, I posted this video basically telling people to stay home because why was y'all like, don't, like why? You know what I mean? So I did this video basically telling people that at this point in time, the ER wasn't the place to go for like very simple things, meaning like if you just have a cough or I used to work in an ER and literally people would come in all the time for a pregnancy test. They knew they were pregnant, but they would come in for a pregnancy test. They would come in for like common cold symptoms where the ER is just really not the place for that. There's nothing that they can technically do for that. They're just gonna like, you're gonna wait 8 hours, you're gonna be really mad, we're upset too, and then you're gonna leave. But in this case, when you walk into the ER, there's people in hazmat suits. You know what I mean? So I made this really funny video telling people to stay home, and I didn't realize it, but it resonated with so many people, and it went viral all around the world. I went from like 2,000 followers to like 75,000 followers in like 3 days, and it was crazy, and it was very emotional too at the time because it's like we're in this crazy situation. And I think it kind of, along with other nurses, it kind of opened the door to that level of honesty on social media. Because before that, there were plenty of nurse influencers. Shout out to y'all because I definitely wasn't the first ones to do it. But I think that it was a different time in the sense like we were not able to be as honest about our profession and our experience and what we were experiencing, and also just our advice to other people. It was more like stay in your place, be a nurse. Your job is going to fire you if you say anything that's oppositional to we're perfect. So it was a good time, and I was like reposted by like Halle Berry, Khloe Kardashian, Steve Harvey, like so many people, Tracy Ellis Ross, like people that I follow. So it was like Viola Davis reposted me, and I was like, huh? So yeah, it went viral for the reason that it was relatable. And then after that, I noticed kind of like how the algorithm works in terms of you don't go viral and keep your following unless when people look at your page from the viralness, they see other things that they like. Plenty of people go viral, but that doesn't mean that you're going to build a following. The following comes when they come to your page and they see other content that is also just as relatable or just as funny.
What we're trying to do.
So yeah, that's what happened.
Oh my God, that's amazing. That's what we're trying to do.
Yeah.
Trying to build a safe space for nurses to
Mhm.
talk about their careers and talk about their personal lives too.
Yeah.
And yeah, like talk about like the Met Gala or something like that. Just find like a space where you can be relatable and be yourself.
Yeah.
And then, because nurses are human too. So I wanted to move into the topic of just like talking more about your experience as a nurse.
Mhm.
I'm not a nurse. I'm gonna put that out there. I'm studying marketing, and if it doesn't work out, I also told people I was like, maybe I could become a nurse.
Okay.
Like do something like that. But just want to ask, what motivates you to be a nurse? Like, what keeps you going?
I would say there's plenty of times where I've thought of leaving bedside nursing. Plenty of times, because it is a lot. I think what motivates me is when I look at a patient and I can see my grandmother or see my auntie or see my uncle in them. And I so much, all patients and nurses, yes, we're doing a job for them, but there's sometimes that you have this extra little bit of chemistry or extra little bit of moments with people where you become the person that now changes their experience. Whether that's just you being very pleasant that day, you explaining something better that day. There's plenty of times where I walk into a room and I'm the only nurse that was able to get that patient to take their meds for the last week. Or I'm the only nurse that was able to get them to let us draw their blood or go for a procedure, or, and it has a lot to do with chemistry, has a lot to do with my background versus their background, where we're from, what we like. Anything can be that little piece of chemistry that puts us together, but it is unique. And some people go to the hospital and never have that experience, and this goes for all nurses. It's not just me. Anybody can have that certain chemistry with another patient. And I feel like the times when I have those experiences with patients, it just motivates me to come back, because it just makes me feel like, okay, if I don't go back, what are those moments that I'm missing with someone where I really can change their day? I mean, I've had so many experiences with just in general, even when you call in Comcast, where it's like that one person over the line is like, you heard me, you fixed my problem, thank you. It's the same thing with nursing. Like, patients just want to be heard. I'm not going to hear every single one of y'all. It's some patients that I'm like, oh my God, Mr. Johnson got me tired. But there's also some that are like, okay, like, we bonded. I made their day better. These people are having the worst day, month, year of their life. If I can be that one person that just makes them like have a better day that day, like, I'm like, okay, I did my, little blessing.
Yeah, like from my own personal experience, that's how I want to be. Like, I want to guide people and give them advice and just make them feel better as a person. That's something I'm working on personally. I'm doing a project for that, but we ain't gonna worry about that. So next question is just more of like, how can nurses support other nurses, like in the work environment or even on your social media page?
So I think that the way that nurses can support other nurses is by talking. One of my good friends is Ellen Pompeo, which is Meredith Grey from Grey's Anatomy. And she always taught me that what changed things in acting for women in acting was other women talking about acting. Like when women started to expose what they were being paid, other women were like, hold on, I didn't know you were getting paid that. I should be asking for that. When women started to advocate for themselves through talking to their peers so that they understood what things were out there that they could get that they weren't asking for, or that they didn't even know was like reachable. So I would say that my biggest thing now is like talking to one another. Like, don't be scared to talk about what you make or how you got to that level or what experience that you had that made you better. We weren't, again, when you've been a nurse for 12 years, now it's been over a decade. We weren't talking about that kind of stuff when I first became a nurse. It was very hush hush. You didn't talk about what you made. You didn't talk about any other job, any other career that you had, any other business, because it was seen as like, these hospitals want to be your main squeeze. They want to be your only priority. Like you can't have any other priority in life and any other opportunity. So right. I think that that's the biggest way that we can support each other, because I can't help you if you don't know what's out there. And when I go to a hospital and I see nurses drowning and like, they got 6 patients, no help, no aids, no phlebotomy, no this, no that. And I'm like, and y'all still here because of what? And it sucks because on one end, I don't want you to leave because then there's nobody to do the job. Somebody has to do the job. But on the same token, I want you to know how to advocate yourself because eventually this hospital does have to level up. And maybe they'll get there through enough nurses leaving. Maybe they'll I don't know what the alternative is, but I'm a girl's girl. So they're gonna have to figure it out. But you, baby girl, you have other options, and nursing can be a very coveted area where people don't communicate that. And a lot of times nurses do, I'm not trying to be funny, people be on one floor being tortured for 4 years and have no idea that there's other jobs out there that are cushy, that are so much more cushy than that. They have no clue what's out there because this is what they're taught, this is what they know. And nursing is not a place where you necessarily travel to other units all the time. I do because I'm a floater, which means I go to a different unit every day. But there's a lot of nurses that stay in one bubble in one unit, and the only people around them are the nurses that they work with, so they don't really know. So just communication.
So what nurses can do is just communicate about it.
Yeah, talk to each other, like reveal it all. Don't be scared. Me telling you my salary, what does that do? Does that change anything? Like if I tell you another job that you can get that's dope, you're not going to take mine. You know what I mean? So it's like just talking to each other. Oh, I got this degree and now I do this. Right. I didn't even know that was possible. Like I have a friend whose job is literally to go around to people's houses after they have had eye surgery and check their eyes. That's her only job, and she makes 6 figures. I wouldn't know that that was even an option for me unless I spoke to her and found that out. So just communicating with one another so we know what opportunities are out there.
When, say, like a nurse, they have a difficult time at work, a patient passes on, and it kind of affects them a lot. And that's what they see, like almost like every day of their life. What can they do to overcome that, like going home?
So I feel like for every nurse, that's obviously different. For me, I try to practice a lot of gratefulness. And I know that might be, excuse me, I think that sometimes can be a little hard to have. But I think that, like, in my life, I've seen people have extremely tough circumstances that they did not ask for or did not contribute to. Some people are born sick. Some people become sick very young. Some people have just like freak accidents. And I think that one of the biggest things that I can do is live my life to the fullest, because there will be a day when I have an illness. There will be a day, like there will be a time, God forbid it happens anytime soon, but there will be a time where I may have a stint in the hospital. Right. And I think that I try to make sure that I live that way. And I mean, in the very small things, like simple things like, oh my God, I got my little matcha tea. Thank God I can swallow. Cause a lot of stroke patients can't, like, you know what I mean? Like, oh, thank God that I can hug my child, that I can breathe without coughing, that I feel like I can take a deep breath in the sun. Thank God I can walk. Like those simple things that we take for granted. I would say mindset wise, that helps me because I kind of look at it like, I'm living vicariously through all my patients in terms of like making sure that I live every day to the fullest. In terms of actual actions, I think that it depends on what makes you decompress. For me, it's the shower. I love showers. It's like my thing. So I'll just be in the shower for like 20 minutes, and whether I cry, whether I laugh, whether I talk to myself, I listen to music. Sometimes what I do that's really weird is I have a full like conversation with myself and kind of just talk myself through what just happened. Sometimes you don't have a minute to like, no, what happened for real? Like what just happened for real? Like, how was your day?
That's
like
me. Like, I literally, that happens to me all the time. Like,
especially in nursing, because who am I going to tell this to? Nobody else, at least in my household, is a nurse that understands the medical terminology and or wants to hear sadness or wants to hear about gross stuff, So sometimes I just have to have a conversation with myself like, yo, what a day. This is what happened. We're going to brush this off. Like I said, whether I laugh, cry, talk to myself, listen to music, I kind of just have that moment to just wash it away. And then I just put on the coziest pajamas or do what else I need to do that day and go forward. But I really feel like it's about like taking it in and putting it out in a positive way,
Yeah. I agree. Man, I'd be having like 5-minute breakdowns, and then the next moment I'm over here dancing in my room listening to music. I wanted to move into like diversity questions because Juneteenth is coming up next week. So it's nice that we have a Black nurse. So I wanted to communicate about it. So I wanted to ask, did you face any challenging moment when it came to like your race background, like in a working environment at all?
So you want me to pick the top three, or because there's
You
plenty.
go up. Go say everything.
So I guess my first moments of understanding like race in terms of like how it affected me was when I first was becoming a nurse, and I wanted to be a labor and delivery nurse because remember I told you I wanted to deliver babies. I wanted to be a labor and delivery nurse so bad, and I just wanted it, and I just couldn't get in. And no matter what, I'm like, why is it so hard for me to get this job on this labor and delivery floor? And then I went to talk to like my other peers of nurses around me, and they were like, oh yeah, they don't hire Black nurses down there. And I'm like, I said, really? They're like, yeah, they don't hire Black nurses down there. And I'm just like, oh, like, why? This is something that was very known and calm and normal for them. Like, it wasn't like a point of like contention or like they weren't upset. It was just like, oh, yeah, like, that's just what it is in nursing. Mm-hmm. So then when I heard it, right, it came to me, but then I also started to see it. And then it's almost like that one thing that like, now that I see it, I can't unsee it. And it's awkward for people that don't see it the same way that I do because you can't see it. Right. You know what I mean? Like you're not programmed to see it my way. So therefore it seems like I'm just always yelling. Prime example, I worked at a hospital again, my job is unique. I'm a floater, which means that I go to a different unit every day, right? Any unit that's within my scope of practice, which is a lot of places. So because of that, I see the differences in each unit, whereas like the nurses that work on that floor don't, because that's the only unit that you work on. Mm-hmm. So I noticed that I would go to some floors and it would be all white nurses. And then I would go to other floors and it would be mostly Black nurses. And when I went to the floors with all white nurses, they had the best equipment, the most staff, the more CNAs. They had more of the resources needed to do their job well. Then when I went to the floors with only mostly Black nurses, they had less equipment. Their CNAs were the first to get pulled to other units. They just had less staff overall. The unit was less clean. You could tell they were just less maintenance. It was less new. I also noticed that the more critical areas like the ICUs, like the units that are more specialized for a certain thing, like for instance, like a cardiothoracic surgery unit was mostly white nurses. And I realized like, oh, so y'all playing in our face for real. Like you playing with us. And mind you, again, another nurse would not have noticed this. For instance, I had another nurse that was also a floater like me, randomly out of nowhere, because why? She says to me, yeah, I just like don't feel like racism exists anymore. And I was just like, oh, okay, why'd you say that? So she's like, I don't know, like I just don't see it anymore. And I was like, oh, okay. So like when you go to, I'm just gonna make up something. When you go to like 4 West, do you notice like anything? And she's like, no. I said, well, when you go to 6B, do you notice anything? And she's like, no. I said, well, have you ever noticed that 6B has all white nurses and 4 West has all Black nurses? And she was like, oh, like I never really realized that. And I was like, yeah, that's probably why you also shouldn't comment on these things, because it's something that you don't have a lens to see. Do you notice how 6B is always staffed and and she's like, oh, so now her lens is forever open because she had someone to educate her and not necessarily beat her down because she didn't know. She didn't know, something that she's not trained to see. But that was my first like big lens into it in terms of like how people, they very quietly move us around to the places that they feel comfortable with us being in without making it super obvious. And I've seen a CNA work on a unit for 10 years, get her RN BSN, and try to work on that same unit, and they moved her to the unit where mostly the Black nurses are, even though she's been on that unit that has mostly white nurses for 10 years. So even in cases where you are more than qualified to work on that unit, they still would rather hire a brand new white nurse than this CNA who's worked there for 10 years, who's now done the work and elevated to a BSN, and she still is not, I guess, good enough to work on that unit. So that was my first experience. And it's a very, again, uncomfortable space, because when you bring it up to anyone, you seem really loud. You seem really loud and really uncomfortable to people. But like, the fact is a fact is a fact. And I'm I'm not going to necessarily sugarcoat the fact because it makes you uncomfortable that's the problem, is that we can't get anywhere because it makes you uncomfortable. And I would say, um, the next thing I would say is that when I did go viral, I noticed how uncomfortable it made my job. And I felt like it was more race based because I had seen other white nurses get a certain level of attention in the media, and it was like welcome. They had a whole news crew inside my job before for this nurse. But when I went viral, it was like, how dare this black girl with this fro come in here and just get all this attention, and it had nothing to do with us, and us not have any accolades from it and any, appreciation from it. So, that was a hard pill to swallow, but it was a pill that was necessary. It was medicine. I needed it. And it was something where I had to just realize, like, I'm different. It is what it is. Like, do you remember when Jefferson had the level up video on the roof during the pandemic, and the nurses are all on the roof doing the level up video? That was very, we're not talking about Jefferson, y'all, just in case. But you remember, that was like, oh my God, like, that was so decent, But my video was like, hold on, you're black. Not too much. Not too much, So I definitely felt a different level of like oomph. And then once the heat got too hot and I was like, you know what? I'm gonna just step back from y'all. It was like, hold on, let's have a meeting, because now we see how much fame you're getting. Now we see like all of these celebrities involved with you. Like, now, hold on, come back, come back, come back. And it's like, hold on, how fair is that? So yeah. And then, there's also the ways in which patients are treated. That part is really hard. When you see a patient that you feel like is not being treated fairly because of their race, it is a bad toll, because how can you prove it? If you can't prove it, it's not much that we can do. They can, how can we support this? I can support it on my 12-hour shift, but how can I support this person when I leave? How can I make this person feel seen in a situation where the next person may not see you the way that I see you? So that's really hard when it comes to like patient care, and especially in the Philly population, where most of our major hospitals have mostly Black patients, but mostly white nurses. So how do we advocate for these patients even when we're not there? And then it's a lot of Black nurses are also jaded and kind of just like whatever, because this is like the norm. This is how we've seen it a million times, where a patient can have, I seen a patient have an ostomy removal and had a dilaudid PCA with 1 milligram per hour, and they're getting pain meds, pain meds, pain meds. Then another patient comes in that's a Black patient that has cancer, debilitating bone cancer with meds everywhere, and they have to fight for pain medicine. So it's really tough to be in that predicament, especially with sickle cellers. Shout out to the sickle cellers, because I always like to give them their love, because they go through so much, especially when it comes into healthcare. A sickle cell patient can come into the hospital, and it is absolutely a part of our regimen for their treatment to give them pain medicine, and they still have to prove that they are in pain, even though that is a part of their care. That is literally their problem. Their problem is pain. We're supposed to treat pain, but they have to convince the healthcare staff that they have pain. So it's like, those things are a thing. It's a thing. And then you make patients disgruntled, and then you call them aggressive. Lord, it's a situation. So being the Black nurse in that can be it's tough.
Yeah, I wanted to go off of that, like the interactions with patients and other colleagues. And I did research on that. And knowing what you said, there's like more white nurses and there's like Black patients, it's nice to be able to have like a nurse or a doctor that has that same background, that experience, because they can give those like their own kind of recommendations.
Yeah.
So really nice. Like, oh my God, that was amazing.
Yeah.
Like, I've not, that was so good though. Like, honestly, all the experiences you went through was, I'm proud of you.
Thank you.
A lot of people cannot get out of that, but like,
yeah, it's tough. And that's the hard part. Is like I said, is like, there's moments when I want to leave bedside, but then I'm like, but who going to check them though? Who's going to advocate when there's nobody else to advocate? And again, that doesn't necessarily mean me giving you extra pain medicine. It can sometimes just mean listening. And when I say listening, I can give you a million examples of why listening can literally change someone's life. Like, perfect example, I had a patient who was a COVID patient, and she had just found out that she had given COVID to multiple of her family members. They were all in the hospital. She was so sick. And every time they would come into her room, all of her chart said
Mm-hmm.
non-compliant, aggressive, non-compliant. And I'm like, why is this, like, what's going on? I tried to go into the room as a blank slate without knowing that information. And she was just very like, like didn't want to talk, didn't want to whatever. And I'm like, after a while, I'm like, well, what's going on with you? Like, why are you not taking your medications? Like, why are you not allowing us to help you? And she was like, you know what? I just don't want to talk. I said, okay. I came back an hour later. I said, listen, girlfriend, we're gonna have to get something together because do you want to leave or not? Like, what's going on with you? You're gonna get sicker. She's like, oh well, I'm just really tired and I'm just really feeling sick. And she's showing symptoms of depression for a black woman. For you it's aggressive. This is depression, what it looks like for a black woman. So when I spoke to her, I realized she's depressed. I'm like, listen, we're gonna get you out of here. Let's turn over, lay on your stomach. Every time a commercial come on, walk around the room. She was able to be off of oxygen by the time I left for my shift. And it was just because of education, just talking to her, getting her out of that rut, letting her feel like someone was listening to her. You know what I mean? And we sometimes, as Black people, the way that we express our emotions is different than other people. And this is, it's a million times. I've had a patient who, cystic fibrosis is mostly a majority of a disease that mostly affects white people. It's very rare for a Black person to have cystic fibrosis. I had a patient, God rest her soul, who needed a lung transplant. Before she had the transplant, this is a floor who's mostly used to dealing with white patients. They were so mean to her. She was the only Black CFer that I had ever met. They were so mean to her. They were very avoidant with her. They treated her like she was just aggressive and combative all the time. The girl is in pain and y'all annoying. And y'all keep coming in here loud, turning on the lights. Like, just relax. And once one person treats you like that, then two people, then three people, you do become a little bit like, all y'all nurses are this way. I had a couple shifts with her. By my second shift with her and me talking to her, she loosened up and we started talking. She started smiling. It takes sometimes one to have people that look like you in the staff, but also just like feeling like someone cares, and that changed her care, that changed her experience. So, it's unfortunate that people can have that experience when you feel so alone in the hospital, but that's what keeps me here.
Has there been any like programs
Mm-hmm.
when initiating diversity, either like in your workspace or anything online?
Are you talking about inside the hospital?
Yeah.
um yeah, no. Like, I mean, I can only speak for my experience, but I have been reprimanded I don't know how many times about speaking about diversity in the hospital. And I mean, on the very like simplest terms. It is not something, it's not a comfortable space to talk about. And even when they do have programs that are meant to be for diversity, they have these programs as they poorly treat staff members of color in their organization. And they only have these conversations in spaces that they feel comfortable, meaning like, you'll have this conversation, but then when I bring up that 6B has all white nurses and 4 West has only Black nurses, it's like, oh, that's not true. Never. No, that's just because of this. We're not really getting down to the root of the issue. So therefore, it makes all the Black staffers check out, because what am I here for? Like, why are we playing this footsie? You know what I mean? You're not really ready to address the problems at hand. You're not really ready to make the changes needed. So I feel like the people who are really like caring about the topics kind of exit the room, and then it becomes a room that has no context. So I definitely think that there is somewhat of an attempt, but I don't think it's a safe attempt for people of color to really try to make the changes. And that's why I feel like social media is so important, because what these CEOs and CNOs don't get from their staffers, they may see online. And that's why it's really important, for now that our voices are so out there, it's going to change things eventually. It just takes time. And I'm really proud of us for being vocal and not being scared, because I say this all the time: nursing, I can get another job tomorrow. So tomorrow, like, really, without any question, I can get another job tomorrow, thanks to Pinnacle. I can get another job with y'all too.
No, for real.
But I can get a job tomorrow. So it's nothing for me to be honest in these spaces where you're trying me, you know what I mean? And that you're trying me. And I'm going to be honest with you about, and I'm going to give you a perfect example. I was on a floor, and there was the George Floyd riots were on the TV. right? And one of another nurse that I was speaking to was a white nurse, but she was a social studies teacher. So me and her start having a conversation about it in the break room. It's just me and her in the break room, right? She starts talking to me about her history, whatever. It was an amazing conversation. She recommended some books that I could read. I recommended some books that she could read. Dope conversation. We leave the conversation. Another nurse must have been walking past the break room and heard the conversation. She went to my superior and said that she felt uncomfortable working with me and that I was combative and aggressive, right? My boss calls me. I'm a night shift nurse. Do not call me at noon. Do not call me at noon. You do not call me at noon. Okay. So she calls me at noon and she's like, I just want to give you a call because this floor said that they don't want you back on their floor. Remember, I'm a floater. I go to all the different units. Mind you, this is the floor with mostly Black nurses. This is also the floor that is in most need of help because they are the dumping ground of the hospital. Okay. She says, "Oh, so this floor said that they would not like you back on their unit. They said that you were combative and aggressive. Do you want to? I'm just letting you know because like this is an issue, and I just want this action to be corrected." And I said, "Well, would you like to know? I would like to know what action you're talking about. Like, what did I do that was so combative or aggressive that made like someone uncomfortable?" She said, "Well, I'm not privy to like tell you like all the details." And I'm like, so you're reprimanding me for something, but you won't tell me what the something is. And basically her opinion or her perspective of what happened is being weaponized without me being able to defend it because I don't even know what she's talking about. So you're not going to put me in a space of even trying to understand what happened for her. I didn't even know. I had no idea who even said nothing. Right. Mm-hmm. So I said to her and I said, well, here's this. How about this? Since this person clearly was upset and felt some type of way, how about we have a sit down with her and we have a conversation and we have a cultural competency education so that we can all feel uncomfortable and comfortable at the same time. She goes, now we're stuttering because now we don't want to talk about cultural competency. We don't want to talk about why that made you so uncomfortable. When we're talking about George Floyd in a closed environment, a personal conversation had nothing to do with you in a break room. Of course, then everything went away. All the reprimanding went away. There was no write up. There was no conversation because you didn't really want to have a cultural competency conversation. You wanted it to end at, I'm privileged and I'm upset and I don't care. You were aggressive. You were combative. This is weaponized now. And it doesn't matter what your perspective is. When it's like, no, why are you upset? What made you upset about the conversation? So I think that that's like the biggest thing is like this is the same institution that's like has like Black Lives Matter on the, like you're not, does it really matter? Do you really care when these microaggressions are happening?
Wow. I'm going through it. I'm getting heated too.
It's real.
But as a nurse, what does diversity mean to you and working in a hospital, really? And then what would you want to see like moving forward, like future wise? How would you want it to be addressed?
I would say diversity means to me for Black and brown nurses to have the same opportunities that white nurses have. And again, if you're watching this and you're like, not at my hospital, it's at yours too. It's absolutely at yours too. It's at every hospital. The only hospitals that I say are not as experienced as that much is more like places like Atlanta, where there's a great big amount of Black nurses there. Places here, like, Black nurses make up like 10-20%, if that. So I think that just making sure that we're engaging in all of these areas, because if I'm a patient and I'm delivering a baby and I'm in the space where Black women die at a third higher rate than other races, it's like I'm in a space where I'm around all white nurses, and white nurses can definitely take care of me. They can definitely do their job and I definitely appreciate them. But sometimes that level of safety and just knowing that there's Black women around and there's spaces that are not off limits because of my color. So I think that that's where the diversity is for me, is to just give us the same room. It shouldn't matter what I look like, what color I am, how I wear my hair, anything. If I have the credentials, if I have the degree, I should be able to be in the same room. And I would challenge anybody who's watching this to also keep that in mind. Like, open your lens. Those same things that I talked about earlier that you may not notice because no one ever gave you the lens. Really look at that. Like, why is the PACU all white nurses? Why is these spaces more white than others? why are there more coveted positions, and are those spaces filled with nurses that look a certain way or act a certain way, or so I think that diversity to me just means everybody being given the same level of courtesy and space to be the best nurse that they can be.
I've learned so much in this conversation.
Yeah.
And like I said, I'm not a nurse, but being able to communicate with other nurses, I learned so much. And especially with our background, like that's crazy.
Yeah.
Not enough equipment, separate floors, like it's wild.
Yeah. But it's very hidden. That's what I'm saying. Like, to the average person, that's why I say, like, when you do talk about it, you look so loud. You look so loud because it's like, I've never seen that before. No, 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 no. It's very like easy to reject because it's like, no way. It's 2024. It's no way that people are like this. But we have to remember, Ruby Bridges is still alive. Like, the woman who desegregated school is still alive. Like, it takes time for these things to go away. It takes time. And even though we have an outward show of racism dissipating, doesn't mean that inwardly people are still not raised with the same mentality and the same mindset. Those people that were segregating schools, they're still alive, and they are that nurse's grandmom. Like, let's be real. So at the end of the day, there is a certain level of education that still needs to be had. And there's plenty of homes where they just don't talk about race at all. That does not mean that racism doesn't exist. We have to talk about it in a very healthy way. A lot of people are like that. We don't talk about color. You should. You should. The reason why we are at this point is because of that. I remember my son the other day, he saw this child that was it's biracial, and he goes, "Oh yeah, mom, they're mixed up." I said, "What?" I was like, "What?" He's like, "Yeah, they're mixed up," and I'm like, "No, Cam, like, no, they're they're biracial. The dad is black and the mom is white, and then they He's like, "No, mom, they're mixed up." So even that is like, it's a conversation. I'm not going to say, "No, we don't talk about race here." No, I'm going to explain to him so he understands. Explain it to your kids, communicate, because they grow up not knowing where they fit into race, and they go off of just your contextual clues of how you treat people versus just understanding what it is. Even if you're not better yet, maybe you still got some racism in you. We all have something. Just communicate, like, to educate yourself and communicate with others. Teaching kids how to deal with race instead of just like assuming that they understand and pushing it to the side.
Wait, how old is your son?
He's 7. Yeah. And like, if he sees a light-skinned Spanish person, he goes, "Oh yeah, she's white." I'm like, "No." So it's like having that conversation. It's not negative. It's just kids being kids. But your kids grow up to still say that at 30 because you're not educating them on culture and how to treat people respectfully.
So I'm gonna say these last 2 questions.
Okay.
It's just something personal.
Okay.
One of them is like, what is working really well with you in your life right now?
Oh, I like
this is the company's questions.
Yes. I would say my self-awareness. Okay. Oh, I hit my mic.
Same.
I would say my self-awareness, because I feel like I'm at a space of being like, I know when I'm tripping, and I could pull myself back. I know when I'm happy and I'm like, "Oh, let's do more of that." I know what makes me feel good. So I'm like, "Okay, I'm going to do that again next week." I know what makes my body feel good. I know what makes my body feel bad. I feel like when I was younger in my 20s, it took me like 10 years to realize that dairy made my stomach hurt. Like, it took me so long when I was younger to realize like what made me feel this. Even in relationships, like, we have such a lack of self-awareness sometimes in relationships in terms of like how we make other people feel, and we just take it as like, this is who I am. No, it's not. Like, take a second to really like understand, like, this is what I need from people. This is who I am. What do I do to attract people that give me that?
Right.
What do I do in workspaces that attract me to get what I need for this? So I feel like that's my biggest thing right now, is just like self-awareness and like understanding myself, and feeling very, I'm not going to say that I'm confident in every area, but self-awareness makes you confident, because then you can change things as you see fit to make you feel better, because you know what makes you feel better. So I would say self-awareness.
Yeah, that's something I'm working on too.
How old are you?
I'm 21.
Okay, it takes time, baby girl. You be all right.
Yeah.
But self-awareness is about like it evolves,
Yeah.
you know? So you evolve with where you are at this moment. Like right now, your self-awareness may just be on like a few different areas, but as you get older, it's going to be on your womanhood and motherhood and your body and like, you know, so many things like start changing around you. So you're doing a good job. And however you're self-aware now, just know it's going to evolve and it takes time and you're going to keep rediscovering yourself.
Like, how do you define happiness? Like, have you found it yet?
Um, so I would say that happiness is not so okay, let me break it down. To me, happiness is a choice. Happiness is not a feeling, happiness is a choice. So I choose what I'm grateful for and what makes me happy, and I choose how I perceive situations, how I perceive pain, how I perceive good, how I perceive bad. Okay. And I know this is like a weird example, so just bear with me for a second. I did hypno babies when I was pregnant with my son. It's basically this way to deliver babies where you change the way you view pain. So instead of a contraction, you call it a birthing wave. And if you change the way you see pain, it changes the way that pain feels, right? And perfect example is, again, don't charge it to my head, not my heart. For instance, if you were to be having sex with someone and they were forceful with you, you'd be like, oh, because that's bae, you know, that's bae. Like, okay, all right, bae does something aggressive to you. Right. It's sexy, right? But if you were doing that same thing with someone unwanted that was raping you, it would hurt. It would hurt really bad because it's like, oh my God, I don't want this. This hurts. But it could be the same level of force that bae was giving, but because you want it from bae or because that's bae, you have an emotional attraction to bae, it feels totally different. You know what I mean? So that's how I kind of look at perspectives in terms of like things that you're feeling. So it's the same thing with pain with having a baby. Right. Instead of me thinking of contractions as pain, I thought of it as work. It's work. Just like if I'm in the gym and I'm doing crunches, it hurts, but you still keep going, right? Because it's work. You know what I mean? Yeah. So if the contraction was work, it wasn't pain. So therefore, I delivered a healthy baby naturally in 4 hours. It still hurt, but I'm just saying that my perspective on pain changed. Instead of me tightening up and be like, I don't want this. No, bring it on because I want to see my baby. You know what I mean? So it's the same thing in terms of that I think of with happiness is like you have the choice to foresee your situation in a certain way, and you're choosing whether you want to see it in an ultra negative way or a super positive way. So I can be mad that I got a flat tire, but then I could be like, oh my God, but I got a car though, and I could afford it. You know, I could be mad that I'm going into work, but it's like, thank God I got a job. It's people out there that don't have jobs or don't have a job that pays them what they want, or don't even have the opportunity. It's people in Palestine starving right now, and you sitting here with a matcha tea complaining. Like, you know, like what do I really have to complain about? What emotions can I turn around and make to be happiness? So that's why I say, like, to me, happiness is a choice, and I make an active choice. And again, sometimes through talking to myself, like, girl, cut it out. It's not even that bad. Relax. I literally will cuss myself out. Like, you gotta chill. If it turns into happiness, that's cool. If it turns into me being brighter that day, it's cool. So I think happiness is just reversing your circumstances in your head and being grateful for your circumstances versus turning them into a negative.
I feel like this whole conversation just feels like, it doesn't feel like it's a podcast. It's just like
soaking it in.
Just like getting to know you, and it's really nice.
Oh, thank you.
All right, well, this is the end of the podcast with Pinnacle Healthcare Staffing. This is our first episode. We will have many more. But I'm Anaya, this is Sheena, and I'm really glad you came. Is there like anything else you want to add?
No, thank you so much for having me, and I really appreciate this. And my Instagram is at Keeping It Kinky. Yes, it's for hair. I usually wear a fro. It's okay. If you guys want to reach out to me or have any questions, I'm available.
Oh, okay.